On behalf of the Patient Safety Authority, I would like to welcome you to this webinar titled Keys to Investigation, Now What? My name is Kelly Gibson and I will be your moderator for this program. Now I'd like to introduce our speaker for this webinar. Melanie Motts is a Patient Safety Advisor with the Patient Safety Authority. She interacts with patient safety officers and other various healthcare staff in healthcare facilities across the eastern region of Pennsylvania in an effort to decrease patient harm. None of the planners for this educational activity have relevant financial relationships to disclose with ineligible companies whose primary business is producing, marketing, selling, reselling, or distributing healthcare products used by or on patients. Mel, I will turn the program over to you.
Thank you, Kelly, and thank you everybody for joining us today. Today, we are going to be talking about a couple things in regards to keys to investigation. Basically, I'm going to summarize the Keys to Investigation Keystone project we just wrapped up over the summer of this year. We have some great resources for the novice and also the seasoned patient safety officer. So for some of you, some of this information is going to sound familiar, and I do know that we have some new patient safety officers attending today. So these are some great resources I think you will find beneficial. And we're also going to talk about how to assess your investigation findings and what are next steps on how to continue to improve patient safety work in 2025. I can't believe we're coming to year end of 2024. And I thank you all for joining me today. I know this is a really busy week. We're in crunch time, leading up to the holidays. So just to kind of set the tone for this webinar, I want to just be clear that this webinar is meant to be reflective and thought-provoking to help guide you into the new year. So keep that in mind as I'm talking over the next 30 minutes. So I do have a polling question to get us started, and we're going to use the Slido feature in the bottom right-hand corner of your screen. And it's a simple question, and my question to you is, do you or your facility perform an annual assessment of your investigation findings? So I'm going to just give just a few seconds here to allow people to answer that question. And just some thoughts, I hope for some of you, I will give you some ideas on what to assess and how to utilize these findings to set goals in 2025. So let's see, slowly coming in. Okay, so it looks like 52% of you said no, that you don't do an annual assessment, and it looks like about 48% do. So almost half there, a little bit more that don't. So hopefully you may consider doing this, ending this year or going into the new year. So let me advance my slide here. So let me talk about our Keys to Investigation project and summarize this project that we did. We always have to bring up MCARE. MCARE, or Act 13, the Medical Care Availability and Reduction of Error Act, per Section 309 of MCARE states that the patient safety officer is required to ensure the investigation of all reports of serious events and incidents and take such action as immediately necessary to ensure patient safety as a result of any investigation, and report any actions taken to the Patient Safety Committee to promote patient safety as a result of investigations commenced pursuant this section. So this is a requirement of MCARE for a patient safety officer to do investigations. The one thing MCARE doesn't do, it doesn't dictate how to do this. So this really is up to you as a facility, how you choose to do your investigations. Investigations don't have to be done just by the patient safety officer. They can be delegated. I'm going to say this later, but you want to leverage your resources and utilize the teams that you have in place. So this may be directors, this may be department managers, there may be some action plans, and things that come out of an RCA that you end up moving over to a performance improvement committee if there's some positive change going on as a result of them. But just to be clear, all event reports do need to be investigated and closed out. So, findings can be documented on the event report. I know some of you have an electronic database that interfaces directly with PACERS. For example, RL Solutions I'm familiar with. There really should be a start and an end to all of your investigations. So this basically was our keys to investigation keystone. So, I said earlier that, MCARE, states that you have to investigate them, but doesn't dictate how you do it. And this was considered in the development of this keystone, and there are many resources available from a lot of familiar organizations, you're familiar with: IHI, Joint Commission, AHRQ, and us, the Patient Safety Authority. So we put together this keystone to assist you in your investigative work. So from July 1st, 2023 through June 30th of 2024, most of you met with your patient safety advisor and were guided through essentially a self-assessment of questions and talking points about your current state of your investigation processes and where there may be some opportunities for improvement or knowledge. And we guided you to, based upon your responses, to attend certain webinars that, we feel you may find valuable or beneficial. I know there are some of you that participated in all of them. And I know there were some of you that came to our in-person workshops. So there was a series of 8 webinars and 3 in-person workshops. We were super excited to do some in-person work with some smaller groups. So those were very successful in the spring. These webinars are still available to you on our Patient Safety Authority YouTube channel for you to listen to and reference at any time. And I'll give you that information in the next slide. But really, the benefits are, to improve your knowledge of the investigative process and the resources used to identify causal factors, and ultimately use these findings to improve system design and patient safety. Okay, so this is a screenshot of our Keys to Investigation toolkit that we put together at the conclusion of the project. And Shelley is actually putting that toolkit in the chat box for you to reference. And you'll see here on the left-hand side, this is the cover page of the toolkit. Basically what we tried to do was, kind of summarize high-level key strategies and techniques in this toolkit for you to utilize when doing investigations. And the webinar titles there, you'll see that they're in green. They are hyperlinked. So if you click on those webinar titles, it will take you directly to the YouTube presentation. So feel free to access them at any time, especially if you didn't have a chance to, view them. So the remaining pages of this keystone really go through some key techniques and strategies you can use in process mapping. My apologies, I'm looking at process mapping there. In performing investigations. Not every investigation is going to be the same, but you're going to find the more you do them and the more you practice doing them, you're going to find what you like to do and what works best for, different scenarios. So, there's examples of process mapping. I'm a big timeline person. I love to make a timeline. Interviewing, we noticed, in chatting with facilities, a lot of the feedback, facilities, feel like they need help in interviewing people. So we have, some good interviewing techniques, and we talk about those in our webinars. Causal statements. I always joke, I know Michelle is online today. Michelle is our director and my boss, and she always states that if you write a good causal statement, your action plan will write itself. And that is true, but causal statements are very difficult to write, but they can really be beneficial in, pushing your action plan moving forward and implementation. And then, of course, talking about your action planning, what are some stronger actions, intermediate, weaker actions? We always talk about education. It's necessary. We need to do it. You all are being educated today. But, there's some better, higher leverage strategies we can put in place to try to prevent, certain events from happening, and, prevent harm to patients, utilizing SMART goals, the implementation plan, and you can see this all here. So this is available to you. It is in the chat box. And, if you have specific questions, feel free to reach out to your patient safety advisor about it. So key takeaways from this keystone, I think we can all agree. I'm not going to review all of these takeaways. You have the slides here, but good reporting benefits all involved in the investigation process. So having good information and event detail is only going to help your investigation. So I always give the examples of, talking to patient safety officers. If I see a report that patient is transferred and there's no other information, I'm probably going to call you, or somebody's going to call you to obtain some more information. So, I always call it nursing documentation 101. Who, what, where, why, how. I should be able to visualize, what happened when I read your event description. So good reporting definitely benefits all. Investigate as needed. So not all event reports are the same. So some are going to be cut and dry, and some are going to be more involved and may require a higher level of investigation, such as a root cause analysis or RCA. Some examples of something that might be cut and dry. I know we all unfortunately deal with falls in our facilities. Let's say a patient fell because the bed rails were left down. Say, the nurse was moving this patient from the stretcher, coming back from an imaging study, put the patient back in bed and, forgot to put the bed rails up and the patient fell out. That's, we kind of know, what happened here versus a wrong site surgery. A wrong site surgery may require a deeper dive or more intense analysis of, why did this happen? And how did it happen? Where did the system fail? In terms of harm, you want to make sure you're in, all events need to be investigated, but do a deeper dive in those investigations that have caused harm to the patient or could cause harm to a patient. Prioritizing them is going to help you really get to the root of, what caused this harm and how can we prevent this from happening. And delegate. I mentioned that earlier. Do you have patient safety champions in your organization? Do you have a pharmacist who is all about patient safety, and is going to review all of the medication errors that are coming across? I know resources can be tight depending on the type of organization you're living in or working in. Excuse me. You want to make sure you're trying to leverage those resources and the people that are interested and have the ability to investigate. Utilize your department managers, directors. Using a risk prioritization matrix. This matrix can help you identify when an RCA is most beneficial. Again, considering the limitations of time and inability to do an RCA for every event. We know you can't do an RCA on every event. But using this matrix will help you identify those events that have the highest severity and highest likelihood to reoccur. How can you best utilize those resources? Tracking and trending. Look at your common themes and do a common cause analysis to correct minor issues before an event occurs. Look at those near misses. Those near misses are gold. A good example, a wrong side or wrong laterality written on the surgery schedule. All of your paperwork, your H&P, your consent form, all of the intake paperwork may say left knee, left knee, left knee, but that schedule says right knee for some reason or another. You got to stop what you're doing, figure out, basically report it and figure out why is this happening? How did a right knee get scheduled? Was it simply a clerical error? Was it originally scheduled a right knee? Maybe the patient needs both knees done. So those are, great things to look at, to try to, look at those common themes and is this happening a lot and why is it happening? We want to try to fix those before they reach the patient. Another example, medication is stocked in the Pyxis incorrectly. If a nurse is pulling out a medication for a patient and something got put back in the wrong area, that's reportable. Report those near misses. Those are really important. And of course, discuss results at your patient safety committee meetings and encourage feedback. As a patient safety officer, you're reporting out reports, what's happening, you're reporting out your investigations, what actions you're taking to prevent them, complete that feedback loop, encourage feedback from those patient safety committee members. If something's not working, lean on them. Maybe they have some good ideas. And update your PACERS report with additional details and recommendations. I think sometimes, we have been encouraging facilities and you to do this for a while. There is a question in your PACERS report. It's question 12. It specifically asks for system improvements or lessons learned. What did you learn from these events? And sometimes we know there's one-off things that happen. You're not going to learn a lesson from maybe every event that happens. But there definitely is opportunity to learn. So anytime you have the opportunity to update those from that question with additional information is helpful to us, but it's also helpful to your peers and other facilities across Pennsylvania. System improvements. Do you have a just culture? Are you focused on system improvements? Has the system filled your staff? I think, if there's any takeaway, good investigations focus on what happened and lead to system improvements, and less focused on, what staff was involved and, do we need to, penalize somebody or suspend them until the investigation is complete. Okay, so I kind of got into those takeaways there. Assessment investigation findings. So getting into how can you use these investigations, pushing forward. So, as a patient safety officer, you're reporting, investigating, creating action plans, you're running these patient safety committee meetings, following up on initiatives. You wear many hats, have lots of responsibilities. And there's time sensitive things. There's fires that you're putting on a regular basis, and we know that. Have you ever stopped to assess the good work you've done through the year? And, I know we tend to be task oriented and reactive in patient safety to ensure that we're crossing our T's, dotting our I's. I'm going to challenge each of you to think about the work you're doing and the roles in your facilities. And as I'm talking about some of these considerations, I want you to write down things that speak to you. So this is kind of an exercise. Is there something your facility would benefit from? And at the end of the presentation, I'm going to ask you to share in the chat box, if you'd like, if you're willing, to encourage others, maybe some things, they can work on. So this is truly a time for reflection and meant to be thought-provoking. So, in your personal life, we do traveling, maybe you've started a new position, and, the list goes on. Maybe you moved, into a new role. From a professional life, are you just, have you really looked at, some of this? Year end is a perfect time to assess your good work that you've done. So I recommend doing this in your patient safety committee meeting, maybe at the end of this year, or maybe it's a good way to kick it off in January of next year. So make time and make this a regular practice to assess your patient safety work. So to invest, to really look at your findings, the first thing you want to do, and I want to be clear, there's no right or wrong way to do this. And you might even consider, having a little subcommittee of your patient safety committee meeting to do this. Look at your event trends. So have you looked at what events you are reporting for the year? I'm sure many of you, are looking at your event reports for your monthly and or quarterly patient safety committee meetings. You have the ability to run reports out of PACERS. I know PACERS is new to some of you, but you can run several different reports, including, what percentage of event types are your facility reporting? Do you need to take it one step further and reach out to your advisor? We have several reports, that we can run. Oftentimes we get the questions from facilities, how are we doing compared to other facilities? We actually have a facility comparison report, so we can look at, a time frame of Okay, over the last 5 years, this is the percentage of medication errors you've been reporting, complications, errors related to procedure, treatment, and test. And then we can compare you to, facilities of similar size. We can compare you to other ASFs. We also have the ability to look at, your reporting rates. So are you on par with reporting? Are you reporting, above average? Are you, not quite where you're supposed to be? We have reports that we can review with you. So reach out to your patient safety advisor if you've never have gone over one of those reports with us. Documentation. Are you documenting your investigations? I think this is important. How you document them is up to you. But like I mentioned in the beginning, you want to make sure there's a start and there's an end. I know some of you have paper forms, and there's like a little blurb at the bottom of what you learned about it and how this event was closed out. Or do you have an investigation form? I know some of you, from talking to you, you have an investigation form, specifically like a deeper dive or more intense analysis, that you want to attach to your event report, as documentation that you did complete it. Or do you need to make up one? Did you perform any root cause analysis this year? What process measures, outcome measures have you put in place? Your process measures are, how are you doing something? What have you measured this past year? Are you doing specific audits as a result of an action plan? Is it working, and is it effective or sustainable? I hear from facilities that sometimes they feel like they have these never-ending audits or never-ending projects. And that may be something you need to think about. How can we put a stop to it? Is this working? Can we stop it for now? And what can we move forward with in 2025? So, sometimes you need to tie up loose ends in order to move forward and focus on new projects. So, assessing patient safety work, reviewing MCARE requirements. I recommend doing this on an annual basis. Are you following them? Do you understand what the requirements are as a patient safety officer, like I reviewed? Your patient safety plan. Your patient safety plan should be visible. Your staff should be familiar with it. They should know how to report events. Your patient safety committee. Do you need more representation? Do you have community members? Do you have residents? Are you missing some people that maybe you think you need to have on that patient safety committee meeting? Patient safety advisors, we are available to you. Some of us talk to you on a pretty regular basis. And then, sometimes we only talk once or twice a year. We're really here for you and, what your needs are. We do love to come out to do education. I know I've personally been presenting at a lot of patient safety committee meetings recently in the past few months, and I've enjoyed doing it and learning about what's going on in your facilities. And, we have great information to share and, love to support you in the work that you're doing. Communication. How is your communication with leadership and staff? Is there communication? Has there been a merger, where, leadership is shaken up a little bit? Your frontline staff. We know, staffing challenges have been a concern, especially since COVID. Education and development. Assess, what type of education are you receiving? Do you need some more education? I know as patient safety advisors, we're currently working with ambulatory surgery facilities talking about infection prevention surveillance. What do you need from a resource standpoint to help develop you in your positions? And culture, celebrate your accomplishments. Do you have a reward system in place? Are people open to new challenges? And I didn't set this up, but this is something you can do to help you set goals for the new year. This is a role-playing activity from Team Steps, if you're familiar with it. And this is the magic wand exercise. I think this is a great exercise because it's simple. and I think really can, have a lot of impact. But basically, it's if I had a magic wand, it can make changes within my unit or the facility in the areas of patient quality and safety. What would they be? And these are some things to think about. And you can do this, with frontline staff. If you are doing leadership rounds, this is something you can talk to frontline staff about. You can also, do this with leadership, and, aggregate the data, see what people are saying. Are leadership and staff in line with each other? You'd be surprised what you find out. So I think a pretty cool exercise and simple exercise to implement to help you in goal setting. So setting goals for 2025, keep it simple. Consider a couple short and long-term goals for the upcoming year. Think about your facility and your work as a patient safety officer. So, set aside, there's, Joint Commission, patient safety goals, there's rulings coming down from CMS. I know there's a lot to think about, but really think about your facility at the local level and, what are some things that, you think you can put in place. So, what is a theme in your investigation findings? Are you finding you did a lot of action planning for cancellations, lots of surgical cancellations this year? Maybe you've seen an uptick in radiology incidental findings. How can we, what's something we can do there? In reviewing event reporting and trends, maybe you're not getting reports from residents. You're only getting reports from nursing. Maybe you have no surgical complications reported, and you learn that from you're reviewing your event reports and realize that you don't have any surgical department representation on your patient safety committee. That could be a short-term goal. Recruit a surgical representative for your patient safety committee, and your long-term goal is to see an increase in reporting from this department in 2025. Did you implement an action plan and did it fall by the wayside due to competing priorities? I bet you there's something that didn't get finished. Short-term goal, implement it, and see how it plays out. Long-term goal, close it out, and if it is successful, pass it on to performance improvement committee, to deploy, facility-wide. All right, so I talked a lot, and I'm just going to briefly bring up an article I recently read that I did share in the resources, and I thought it was so interesting. So this article, it's called Envisioning Patient Safety in 2025, and it was published in 2008. And it basically, there's thought leaders that were, presented with two tasks, and it really truly was a reflective article. The first task was to envision patient safety as you'd like it to be in the year 2025, which is hard to believe that is next year, and beyond from the perspective of your own area of expertise. So this included, healthcare change leaders, health information technology leaders, patient-centered care, device safety, simulation. And the second part of the task was to describe what changes need to fall in place between now and then in order for your visions to be realized. So it was so interesting to read because here we are in almost 2025, and I have to say some of their visions did fall into place, and some didn't yet. So definitely a pretty neat article to reference considering, we are going into the year 2025. It just goes to show, how it really does take time to make change in healthcare. So just to leave you on this, if you're continuing to do the same thing over again, old mindset, old results, break the cycle, you need to reflect on what you've accomplished, completed over the past year to make change. We know healthcare is complicated. And I said it before, we tend to be reactive, especially in patient safety. Take this opportunity to be proactive in 2025 and, be a catalyst for change and set the tone in your organization. So, before we get to the Q&A portion, I understand that you haven't had a chance to review your investigation findings in this past 30 minutes, but off the top of your head, and if you'd like to share in the chat box, please type in an idea you have. Maybe I did get you thinking a little bit. Is there an opportunity for improvement that you know that you've done a lot of RCAs on something? Or maybe it's just something simply in your patient safety work. I'd love to hear and see what people have to say. So maybe it's even a goal that you wanted to put in place for this year. So please, type in the chat box to everyone if you do feel like sharing. I see here, investigation tools would be nice to have. Does anyone have they are willing to share? And Sabrina, the webinars have a bunch of, different types. We have a everyday investigation webinar to give you an ideas, how to complete some different types of investigations, whether it is a root cause analysis, a common cause analysis, a parent cause analysis. And to answer your question, Sabrina, there's a toolkit that is in the chat box. Those webinars are available on the Patient Safety Authority YouTube channel. And in our toolkit, our investigation toolkit, you can click on the webinar title and it will take you directly to that presentation. We used our data to focus on FMNCA. Awesome. Thank you, Jean, for sharing. So I don't see anybody sharing much else, and hopefully you're thinking about it. But I'm going to turn the presentation over to Kelly, and we can start our Q&A session.
Thanks, Mel. And I know there was a question about the article you referenced, Mel. So that is listed as a reference in the PowerPoint presentation. I did also copy that and put the link into the chat box as well.
Thank you, Kelly.
Sure thing. Do have one question about how do I start to do an assessment of our investigation findings, and is there a tool?
Oh, that's a great question. So there is no specific tool, but you can start by evaluating your event reports and your action plan. So, take a look at the action plans you put in place and, take it from there. Were they successful? Was something, did something fall by the wayside and needs to be started back up again? Part of doing a good investigation and, good implementation is to continually evaluate and make changes as needed. And, it is recommended, after you do implement an action plan that you revisit it 6 months later. And maybe this is the time to revisit it. Maybe you haven't had a chance to revisit it. So, I think just starting with, looking at your event reporting and looking at your action plans is the best way to start.
Thank you, Mel. I don't see any additional questions. So I think there was a lot of great thought for people to kind of, like you said, closing out the end of the year and getting started on the new year. So thank you so much for all this information. I want to thank everyone for joining us today. If you experienced any issues accessing the evaluation and/or certificate of continuing education, please feel free to direct any inquiries to Shelley Meixel at shmixell@pa.gov. This concludes our webinar. Thank you.